Hey, this is Paulius, and you're listening to Voices of Table Rounds. This is another episode in our series on making connections in medical education, with the goal of featuring really awesome individuals who contribute to our learning and help us grow as educators. Today we have Dr. Rahul Barmanray. Welcome to the podcast. For those who don't know you already, tell us a bit about yourself.
Hi, I'm Rahul. I'm an endocrinologist and a general physician here in Melbourne, Australia. Currently in lockdown 4.0 for us at the moment, but trying to, in the midst of all that, complete a PhD as well as doing my general clinical work. PhD area of interest is inpatient diabetes. We're trying to bring proactive care to the diabetes world. In addition to that, I've also got the privilege of teaching my second year Doctor of Medicine students. They're currently in the first year of their hospital setting, so still very new to the whole medical training in clinical context, but seem to be picking things up as well as one can for people who've been in lockdown for such a long time.
I came across your work with ClinicFire. Can you tell me about what this project is and how you got it started?
Yeah, look, it really came about from me sitting in an outpatient clinic for the nth time, trying to work out where it was the best site that I found to type in a Dutch lipid clinic network score, or to work out the calcium creatinine excretion ratio. And I remember Googling it maybe 3 weeks before or 3 months before, and having to go through that process again. And thought, oh, surely there's a better way that I could just sort of save all these links somewhere, because whenever you go to a clinic or a new computer, a new part of the hospital, new place, you can't sort of save things on your browser. So what if there was a website that contained all these common links that we use, not so frequently that you remember the site just off the top of your head, but frequently enough that it gets annoying that you say, oh, surely there's a way I could have remembered this. So that's really where it all started. And luckily I had a mate, Alex, who's an anaesthetist, and he's a much more effective and experienced coder than myself. So I was able to put all this together. That's where ClinicFire was born. So I started off very much in the endocrinology space, and then we told other clinicians about it, and they said, oh, that'd be a great idea. Why don't you chuck these links in? These are links that I'd like to use all the time. And now it's sort of grown to a couple of specialties, and slowly growing into a couple of other areas as well.
Fascinating. Can you tell me more about the process of building this website? It seems like a pretty big undertaking to try to pull together all the useful links as a directory for medical websites.
Yeah, look, very much an iterative process, as you might expect for something like this. As I said, we started off pretty small, had a couple of links. Just really, it was my favorites list for endocrinology clinic, very specifically. And then one of my colleagues happened to walk into the room when I had it open. They're like, "Oh, what's that?" "Oh, it's this is what it is, and this is what I use it for." I'm like, "Oh, that'd be good. Hey, do you have this site there?" "Oh, that's a good idea, actually. I should put that site on." And so then it sort of grew from there. I'd record some sites that I'd use, and record some calculators that I found useful, record some other resources other people told me about. We'd add them on. Other people would start using it. Other colleagues, that is, would start using it, and they'd say, "Oh, actually, you should really put this link on. You should really put these links up." So it sort of very much link by link grew into the much larger website that it is today. So if you start off very small, over time, just through what is useful, things can grow in size very easily.
So how long have you been working on it?
I think it's been about a year now. So, so it started off in COVID lockdown, and slowly been increasing over that time. And there'll be times when we'll suddenly have a slew of a whole lot of links that we'll want to add into it, and there'll be other times when there won't really be all that much new, all that much fresh that's happening. So fits and starts. As many of these sites and projects tend to increase in size, was very much how we grew.
It certainly looks like a mature website. Can you tell me how medical trainees and practicing physicians might benefit from this?
Certainly the value proposition is for practicing physicians. The idea is that they're sitting there in clinic, they can't remember those links, they just jump on ClinicFire, type in what the thing is that they're trying to find, and hopefully the matching is good enough that they're able to find something that is very much what it is that they were looking for. Medical students and medical trainees can benefit in that often some of these niche specialty websites and niche specialty risk calculators and scores and so on are not so easy to find, not so easily publicized. You get on UpToDate, you get on Dynamed, or whatever your link system is of choice, and you'll have links to some society guidelines and so on, but you won't necessarily know the organizational knowledge, so to speak, that exists within a specialty. And so if you happen to have been in that specialty's clinic, then you would have seen some of those links be used, some of those websites be used. But if you didn't have that experience, didn't have the benefit of that exposure, then you might not necessarily come across those things. So you might hear about something in a lecture and say, oh yeah, okay, well, I wonder if there's a useful site that brings that information together. You can jump on ClinicFire and find it. But it's very much meant to be used in practice to streamline the speed at which you can see patients and outpatients by not having to muck around trying to find those resources that you just can't remember where they were.
Do you have any tips for somebody else who wants to create something like this resource for their own community?
Yeah, and so it's probably important to say that ClinicFire is very much specific to our local Melbourne, Victoria, Australia community. And something like this, if you tried to include all the relevant links to a group of practitioners working in a much larger jurisdiction, well, suddenly the whole thing would be unwieldy as to not be useful. So it's important to make it specific to your local context. So if someone else wanted to do this in their local context, it would probably be a case of starting small, starting in even in a specific clinical context, like my endocrinology clinic, or like your hematology or respiratory, whatever it is. See those sites that you use more often and use less often, start chucking them into a website like this, and then get the word out there and build off your community. People like being able to say, hey, there's this really great website, you should put it on there. And then you put it on, and then they go on the website, and it's like, yeah, there it is. And you're able to have a shout out to them and say thanks to those people. They feel good about it, they contribute to it, and it really does make it more useful for everyone. I've come across all these resources just by colleagues that have said, hey, this would be great for ClinicFire. And I was like, oh, I didn't even know that was a thing. Excellent. I jump on it, explore it, and we all learn from each other. So it's not only a useful tool for use in clinic, it's also a useful community building experience. And so something I strongly encourage people to do themselves.
I was just thinking that, actually. I mean, you're going through this process and building up ClinicFire, and not only are you, I think, getting more resources that are more helpful to you as a clinician, but also you're meeting like-minded people who are passionate about medical education and sharing resources. How do you see it evolving in the near future and maybe in long term, if you have a vision for it, or is this something that you're just having fun in the moment?
Yeah, look, I suspect it's probably more the latter, and hopefully, in addition to having fun, it being actually useful clinically to those people that end up using it. But around something like this, particularly something organic and something built around a very core idea, which is trying to speed up people's clinical flow. If a community develops around it, and a community who's keen on improving their clinical work and learning from each other, then there are many ways in which this could go. This could sort of extend further into the medical education pathway, where it's already starting to go. People are sort of sharing their medical education links from. So there's a nephrology blog, a nephrology medical education blog specifically, and one of our nephrologists has sort of suggested that, and so that's ended up there. And now the hematologists are saying, oh, actually, there's this prof hematology website that teaches things in a very simple way, not only for their trainees. I'm sure they hope that some of the specialists, like myself and my colleagues, will learn something from it and not refer them stupid things like we probably do sometimes. And so, that may well be a path it goes down, that we all end up learning from each other around a very simple and lean core idea.
How has your approach to learning evolved as you transitioned from being a student to a resident, and now, you're a full-on attending, teaching others?
I must say, when I was a medical student, I very much tended to rote learn things. That was, I think, the way that many of my colleagues and myself had got through high school, and that was just the process that we took into med school. And you get told often that the best way to learn is to hang your knowledge on a particular patient. The first time you see a patient case, you'll never forget that. And it's easy to say, oh, look, this method of learning has worked for me. I'm not going to try something different. I'm smarter than these other people telling me how I should be learning. But as I've gone along, as most med students undoubtedly have as well, the value of being able to link things back to a real human story is, I mean, how the human mind works, and we know that from innumerable studies. And so being able to link medical knowledge to a particular case, being able to link things together in the context of the real human suffering, understanding, and growth that we all get to be part of is very much the best way, I think, now to learn. Similarly, schematic learning is increasingly useful. I think medicine's always shied away from checklists and algorithms for good reason. There are clear examples of where checklists and algorithms are very beneficial. At the WHO surgical safety checklist, I mean, that's objectively saved lives. Like, we know that there is a role for those sorts of things. But I think schemas bridge the gap between the physician as expert thinker and having an algorithmic sort of rote learned point by point, and it's probably used in a disparaging way, but robotic way of thinking. I think everyone is increasingly understanding that there's so much information that you can't possibly understand everything, and clearly, virtual table rounds is trying to make that more enjoyable. If you can hang your knowledge on individuals, and if you can hang your knowledge on a schema, then it makes it much easier, and much more enjoyable, I think, to learn things, and then in the moment to be able to access that knowledge.
What's the most memorable advice you've received as a learner?
I remember being told when I was a young intern by a now colleague, actually, who I'm very blessed to be able to work with now, that I think the term that he used specifically was that one should embrace cognitive dissonance. And he didn't actually explain it at the time. I didn't really understand it at the time. Many years later, when the same well-respected mentor was teaching us as basic physician trainees, so a couple of years later, while we were doing our what we call physician training in Australia, he explained this with an allegory, which I'll never forget, and which I mentioned to my own medical students. And so he said, look, if you're walking along a beach of smooth sand and everything's fine, you're just cruising along, there's no real issues, you're just enjoying your stroll, then it's great, but you're not growing, you're just enjoying yourself, and you're just getting from A to B. When you come across a dune of sand, well, you can have two responses. One is that you can say, oh damn, there's this massive dune, I now have to scramble up, and I'm going to get all hot and sweaty in the sun, and then I have to go down the other side, and this is really annoying. Or you can get really excited and you can say, hey, this is something unexpected. This is something that shouldn't be there. Why don't you start digging, and just maybe you'll find some buried treasure. And so in clinical practice, perhaps more operationally, what this means is if not all parts of the story fit, then maybe it's just because this is an atypical presentation and that's annoying. You just have to get over it and manage the patient and deal with this slight atypia. Or maybe not everything fits because the path you were going down isn't the right path. And this is an opportunity for you to change tracks, to actually find that right diagnosis, and to not get stuck in the cognitive bias morass that you have and continue down the pathway that you've already started.
I love that. I think that's really cool. And I'm not surprised that you're using a beach as an analogy, because where you are. Online medical communities like Twitter have really changed the way we exchange knowledge with each other. And I was introduced to it, early this year. Certainly pandemic has contributed to spending a lot more time online. I'm curious if you can think of any other learning resources that you wish you had in your training or that you just came across. I know you're probably putting them up on ClinicFire, but just curious if there's anything that you would suggest other trainees should include on their radar.
I think there's a wealth of specialty-specific information that's presented in really quite great ways, which is often overlooked. Look, it's easy to focus in on the really large resources and to pay attention to those resources which are multi-specialty and multi-area in nature. because you get familiar with a particular way of dealing with things, a particular way of accessing information, perhaps more correctly. And if that particular way of accessing information deals with lots of different specialties of information, then you can learn a whole breadth of the medical knowledge that you need to learn from one source. There's a lot of perhaps flying under the radar, specialty-specific, often blogs, sometimes micro websites that are really very limited in scope. There'll be say like a Prof Montage back in the day, the cardiology website that had a whole lot of murmurs that you could listen to. Was very limited in scope. It just had a whole lot of murmurs that you could listen to, but they were really good recordings of really quite, in many cases, rare murmurs. And so that was a way to get that really specific knowledge in a really great way. But you wouldn't go to it for anything else because there's nothing else there. And similarly, there's a whole lot of renal bloggers, I think I've mentioned previously, hematology websites, so Practical Hemostasis, which I'm not sure if that's an Australian or a US website. It's globally available. And all of these things that I'm mentioning are, of course, on ClinicFire. Do talk about really quite limited areas of medicine, but in great detail and in really very vibrant and prescient ways, because they're made by the experts who've had years of experience of teaching these concepts to their juniors. And so that's who you want to learn those specific bits of knowledge from. It can be hard to find some of them, to be sure. And so, you've got to keep your eye out on MedTwitter to see what people are linking. And, when you get an online medical community or even a physical medical education community, then make sure that you share around resources. People will serendipitously or more deliberately come across these things, and it's important that you do learn from each other. But don't eschew the limited scope, hyper-specific, but often really quite valuable, specialty-specific learning tools that are available out there.
Completely agree. I mean, you want to learn from the experts, right? It's like calling a consult, but for yourself.
Pretty much.
I don't know if you remember when you came across Table Rounds for the first time, but can you think back to when you noticed us, and what was your initial impression?
And look, it really sort of speaks to the serendipitous nature of many of these connections that occur. I know Virtual Table Rounds is, of course, all about connections, so I don't use that term ironically in the least. I think I started following a couple of people on on Endo Twitter actually, who similarly posted on Med Twitter, and then happened to see some other things that some other people liked, and a couple of follows and likes later, ended up someone who I followed liked Table Rounds, and it sort of saw this thing. I was like, oh, that's cool. Click on that and have a look, and I was like, oh wow, it's a really great idea. Let's make connections, because that's exactly how we teach our students to do their long cases. The whole idea of a long case type presentation is you spend an hour with the patient, you present the case for 10 minutes, you get asked by the examiner 5 minutes of questions, is to come up with a story where everything is connected. Everything that you say in the history of presenting complaint, the past history, the medication, social history, your examination should link almost sequentially to your issues, which then should tell the examiner, this is what I want you to ask me about, because this is what I know the answer to. Talk to me about this, because this is what I am on comfortable ground talking about. Because you've made and you've shown the connections all the way through between the things that are missing in the medication list and the signs that you found on their examination. So medicine is all about connections. And so Virtual Table Rounds is at its core medicine. So when I saw that, I was like, oh great, this is how we teach our students. Answered a couple of the questions up there, and started a couple of conversations with some other people that were answering up there. So look, it really does get to the heart of what clinical medicine is about, as well as the rote knowledge that you need to learn as part of your medical training, and making that more enjoyable. Can't recommend it highly enough.
Thank you. I think that's great. Is there anything else that you'd like to add in addition to what we've already discussed?
Oh, look, we've talked about a couple of things. We've talked about lots of great resources. I think the thing that medical students need to be aware of is that when you're an early year medical student in this great big wide world of a hospital, and an even bigger world of your chosen specialty, and spanning the entire world, camaraderie of physicians, which it's easy to get on med Twitter and sort of see all these things that are happening in all sorts of different parts of the world, and hey, these people are doing this and these people are doing this, and how am I ever going to measure up? Well, it's important to remember that everyone's been there, that everyone's experienced the same thing that you have, and everyone's experienced the same existential dread at 3 o'clock in the morning that they're not going to pass their exams, and experience the same amazing feeling of joy, really, that they were able to be involved in that particular patient's care. And early on, it's simple psychosocial stuff. You were the person who noticed that the patient was coughing a lot and looked like they were a bit thirsty, and at the end of the ward round, you sort of said, "Oh, hey, can I get you a glass of water?" And you made that patient stay. And then later on, it's, hey, you were the one that realized that particular abnormal lab was missed, and then later on, it was you identified the fact that people have been thinking down a particular pathway for this patient for years, and really they've been neglecting an important key piece of information, and you made the diagnosis and you potentially saved a life. And you will get there. Think of all these people that you see around you on med Twitter, in your hospital and so on, as people to guide you, as mentors and people to look up to, rather than people to be afraid of, people to feel insecure in the light of, because they were you once.
Thank you for joining us. Check out Rahul's project, ClinicFire.com. Really excellent resource, and you'll be surprised how much information it contains. You can find us on social media, particularly Twitter. We put out a lot of live challenges that you can participate in. Also, head over to tablerounds.com to purchase your own copy of the game, and you can take it to your medical school or residency to play with your classmates.